My name is Lieutenant Junior Grade Bobby Bradford. I'm an ICU nurse aboard the USNS Comfort. My role on the ship is I'm an intensive care nurse. When patients come aboard that are critical, they come to the intensive care unit, might be on a ventilator or several vasoactive drips. My job is to care for them, execute the physician's orders, and try to get them healthy as soon as possible. Some of the biggest challenges are just the number of patients. Working in a new area on a ship is different than working in the hospital. We're providing excellent care to all the patients. We're split into 4 different teams. Some of the units are COVID positive patients, some of them are COVID negative patients, and we try to group the people who are on the ventilators together just because they require a higher level of nursing care. Well, my role as an ICU nurse directly impacts the medical mission. Nurses have the most hands-on patient care. Physicians make the decisions, but nurses execute those decisions and are at the bedside 24/7. So I would say all the nurses aboard the USNS Comfort provide a significant role in the medical mission. We're providing excellent patient care to as many patients as we can, but we are taking as many COVID positive, COVID negative to try to assist to take some of the burden off the hospitals in New York City. We are doing everything we can, working around the clock without days off, just like the other healthcare workers in the hospitals in New York. So, New York is in the middle of a crisis. They're in a fight, and I'd be the first to volunteer to come back and help out and do what I can. Being in New York City on 9/11, it led me to join the military. Even though I enlisted in the Army and spent 11 years as a combat medic, multiple trips to Afghanistan to try to make the people responsible pay for what they did to New York City on 9/11. And it's bringing everything full circle, coming back to New York City as a Navy nurse in a time when New York City is in a crisis again, and to be able to help the people, the citizens of New York City, and help them out medically as a Navy nurse. Since this is my first time back to New York City since I left almost 20 years ago. It's good to be back and helping out.
More or less, we're the ship's ER. We also handle transporting patients that get dropped off by the EMTs, and we handle moving them from there to the wards so they can get taken care of here. In between patient care, when things start to go into a lull, we always try to maintain a certain level of preparedness. And because we have such a wide array of sailors from different backgrounds, because sailors tend to be sent all over the place, we're always just sharing each other's information, training. We're always going over how to do proper IVs, using things like the blood transfusers, the pro packs to maintain or keep an eye on how our patients are doing. As a team, we've had to, for one thing, acquaint ourselves with each other, try to figure out the best way to work fluidly, considering a lot of us have never worked with each other before. They gave us roughly a week to get ready and move out. We try to support each other as best as possible. Everyone's got a different story. I am very thankful that all these sailors from all over the place packed up their bags to come help. I'm from New York, so it's really close to me, and I joined the Navy to get on a hospital ship and actually do humanitarian stuff, so it's kind of like what I've wanted to do. I have family who passed from the virus, and it feels good being here. I was on a run on top of the ship, and I got a text from my father. He told me my uncle had passed away, so I immediately called the rest of my family to see what was going on, just to check how they're holding up. It's been rough because no one can really check on anyone because everyone's in isolation, and no one wants to make it worse by spreading it to family members. So the virus was real in me, but it got even more real when I found out. So the mission doesn't stop just because I'm hurting. my sailors expect me to keep my head up, keep doing what I'm doing, so I absolutely feel that we're making a difference. I see it whenever we bring patients in. They look nervous, but I know that we're going to give everything we can. We sacrifice a lot just coming out here. We don't know how our family is doing back home. We don't get to check on them, but I do absolutely love patient care. I like seeing other people use their hands to pick other people up. Corny as it sounds, it's the truth for me. So I'm proud to work with this crew. I haven't spent that much time with them, but we're here.